Next week is World Prematurity Day, meant to bring awareness to preterm birth, which affects 15 million babies all across the globe, and 1 in 9 babies in Fresno County alone. It is the leading cause of death in children before the 5 years of age, and Fresno has one of the worst rates in the nation. So, how is the Valley recognizing this day? Well, let's ask Sandra Flores. She's the director for the Fresno County Preterm Birth Initiative, and Erica Martinez. She's a community member and a member of the Fresno County PTBI Parents Council. Welcome, ladies, to the show. I'm going to start with you, Sandra. Tell me about the initiative. Tell me about your organization, the Fresno County Preterm Birth Initiative. What is it?
So it's a 10-year initiative.
Okay.
It was launched with a grant. So there's a California effort and an East Africa effort. So $100 million from Mark and Lynn Benioff, our funders here in California, and Bill and Melinda Gates Foundation for the East Africa effort.
So you're saying it's Africa and California?
East Africa. Nairobi, Uganda, and Rwanda are included in the East Africa effort.
And what about just here in the entire States? It's just California? Does that mean that
Fresno County, San Francisco, and Oakland.
Wow, so it is true. We have one of the worst rates.
Right. And so the initiative is 10 years, and it's predominantly a research initiative. So the grant went to UCSF, and it's predominantly funding a lot of research, so we learn more about the issue. In Fresno County, we're taking a collective impact approach to examine the social determinants that are tied to the issue. So we have a steering committee of 22 people, including mothers who have the experience of preterm birth. And we have 3 priorities in Fresno County that we focused on. It's health and education before pregnancy, care and support during pregnancy, and the coordination of care before, during, and after pregnancy. So we are, our goal is to reduce preterm birth from 11.1%, that's our current rate in Fresno County, to 7%. Those are our 3 priority areas, and we have work groups in each of those priority areas developing strategies in those priority areas.
What kind of strategies?
So one, in the care and support for pregnant women, a strategy that was developed was group prenatal care. So the work group really examined the benefits of group prenatal care and some curriculum and models that have already been tested in some other areas. We had lots of conversations with providers in our area and other partners, Calviva, First Five Fresno County, and the 6-year demonstration project came out of that work group. So they said, this is a strategy we want to explore. That evolved into a proposal for a 6-year demonstration project, and Erica is actually one of the facilitators for that group prenatal care model. That's Expect With Me. That is, it's a demonstration, so there's no, I want to be a part of it. You have to go through your provider to be a part of it.
Okay, so tell me about it. Tell me about it, Erica.
So the group prenatal care, like Sandra said, our participants are referred by their doctor. And what they do is they come to us instead of doing their traditional care during pregnancy. So instead of going to their monthly visits at their doctor's office, they will come and see us. And we have a nurse practitioner there that does their monthly checkups, anything that has to do with pregnancy. But in addition to that, what we want to do, and the idea behind it, is to build community within the moms that are in the group. So these moms are the same moms from beginning to end, and we have different sets of moms that we're working with.
How will that help preterm babies?
So the research says that a group prenatal care model, and we're using Expect With Me, that's the curriculum, it reduces preterm birth by 33%. So it is the learning, so the curriculum is focusing on breastfeeding, health, social and emotional supports, things, depression. And so they go through this curriculum, the duration of their pregnancy, and the benefits of it based on the research are tremendous.
Okay, I'm curious to find out more about the research, because are you saying that sometimes maybe depression can lead to premature birth?
It's certainly an experience of being pregnant. The postpartum depression is associated to what's going on in a woman's body after pregnancy. And And but sometimes some of these issues are already in place and not diagnosed until they go see, they're confirmed that they're pregnant and they're seeing a doctor. So just the whole, the support that a pregnant woman needs during pregnancy.
And that's
is
what
we're trying to do.
that's what you're giving to the entire community.
Yes.
Not just support, but also you're bringing awareness through this event, which is going on Friday, November 17th. It's next Friday. So everyone is invited, and they're going to have all sorts of activities, really, not just educational activities, but there's going to be a car show, food, activities for kids, and most importantly, a health resource booth. Plenty of them, right?
Yes.
Parents will share their personal stories when it comes to preemies, and even Fresno landmarks will be lit up in commemoration, including the Shahidi Tower at the Save Mart Center. So all of this is going on across the globe, everybody, to mark this event and to recognize World Prematurity Day. We can go on and on and on about this. Wow, these ladies are so interesting. But if you have any other questions, call the number that you saw there on your screen. And remember, the event next Friday. Thank you, ladies, for being here. Appreciate it. All right. Still to come on Central Valley Today. How